Robot-assisted surgery has significant advantages for both novice and skilled surgeons, delivering a more precise arthroscopic operation while reducing both unintended trauma and recovery times for patients. Surgeons perform more than 4 million knee arthroscopies annually, costing the global healthcare system over $15 billion. Demand for arthroscopic procedures is growing, so is demand for trained surgeons to perform them. Like any new skill, there's a learning process to master arthroscopies. Research shows that surgeons need to treat 170 cases before they reach baseline competency, and sometimes they get it wrong. In a recent survey of orthopaedic surgeons, more than a third felt that the rate of unintended damage to patients was at least 1 in 5 procedures. About 7.5% of surgeons believed the unintended damage occurred in every procedure carried out. Arthroscopies are well-established, minimally invasive procedures for diagnosing and treating knee joint disorders and injuries. A camera and surgical tool are introduced into the knee joint through small incisions in the skin. During a knee arthroscopy, the surgeon needs to control the leg, the camera and the surgical tool, all while watching a remote screen. It's both physically and mentally exhausting work. The complexities associated with arthroscopies mean it takes a long time for surgeons to master the procedure. There's a real risk of causing unintended damage during surgery or the patient developing post-surgery complications. And here's why. Arthroscopies are physically demanding for surgeons who must manipulate the patient to access the joint. Surgeons lack depth perception when using conventional tools to see into the joint. They have a limited field of view, and they experience counterintuitive hand-eye coordination between the scope and the surgical instruments. That's why there's enormous potential in developing technologies to help these surgeons, or eventually take over the procedure entirely. Advanced robotics and imaging technologies can alleviate the workforce stresses on the global health system while improving patient access to health services. Researchers at QUT are developing several key technologies that could be available in the near future. They're aiming to combine these platform technologies to develop a complete autonomous system to perform knee arthroscopies. The system has 4 components: steerable robotic arthroscopes and tools, autonomous leg manipulators, novel stereo cameras for intra-knee perception, and 3D, 4D ultrasound imaging for tissue and tool tracking. Steerable robotic arthroscopes and tools have the flexibility to maneuver within the confined spaces inside the knee joints while maintaining intrinsic safety during operation. Autonomous leg manipulators can hold and adjust the leg configuration to create the gap that's required for the surgical procedure, also relieving the physical stress on surgeons. Stereo vision provides reliable depth perception so robots can successfully navigate the knee joint. Tracked 3D, 4D ultrasound imaging allows the robotic system to see and identify in real time the objects inside the knee. Though not yet a clinical reality, these novel robotic concepts, combined into a platform technology, will help surgeons perform knee arthroscopies and improve patient outcomes. The system could be applied to other minimally invasive surgeries like hip arthroscopies and intra-abdominal surgery, but could also be applied to non-medical fields like search and navigation.